Hi, everyone. Thanks for joining. We'll be getting started shortly. We're just going to wait a couple more minutes to allow for more people to join. We'll be with you shortly.
For those of you who've just joined, we are going to get started shortly. We're going to give everyone just a few more minutes. Greetings, everyone, and thanks for joining us. I think we'll give everybody about 30 more seconds, and then we'll go ahead and get started on this Friday afternoon. It's August the 7th, 2020, in case anyone is having trouble keeping up with the date like I do. All right, shall we get started? So thanks everyone for joining us on this Friday afternoon to get an overview highlight of understanding the impact of the Research Data Alliance COVID-19 recommendations and guidelines on data sharing. Today, we're going to have presenters from the US who have participated on this, but I'd like to make a note that we're supporting our local RDA, but this is a global initiative like everything RDA. So really very appreciative to everyone who has participated in this with the Research Data Alliance. And I know that each one of our speakers will also be highlighting some of their co-chairs and what they've done in the group. So let's get started. Get your popcorn ready, your cup of tea, or anything stronger if that's what you're doing on a Friday afternoon. So, all right, just real quickly, here's what the agenda is going to be. Actually, introductions are going to come as people come through. I'm going to give you a little bit of overview of the RDA, and then we'll get right to the presentations. We do have places for question and answers. We have a little bit of time in between each speaker. So if you have a burning question for them, we will ask one or two, time permitted, and then we'll also have a Q&A session at the end. But please put your questions and answers down in the appropriate place within the GoToWebinar. So just wanted to thank, I'm Leslie McIntosh. I didn't really want to thank myself, but that came out wrong. So I'm Leslie McIntosh. I'm the RDA US Executive Director. But truly the contributors to this webinar are the other people that you see on the screen, which is Yolanda and Mary, who are behind the scenes, and they may chime in if there's something perhaps that I've missed. There's also our wonderful panelists, Dr. Stephanie Russo-Carroll, Dr. Dawei Lin, the wonderful Natalie Myers, Dr. Daniel Meechin, and Dr. Amy Pienta to talk to you about this important topic on research data and in the COVID-19 environment. So let me just talk about what RDA is first, and why is it that we got together to talk about COVID-19 and research data sharing. So the vision of RDA is that researchers and innovators will openly share data across technologies, disciplines, countries to address these grand challenges of society. And our mission has been, since 2013, when it was founded, to build the social and technical bridges that enable this open sharing of data. So we've really been working on this issue for a number of years now of sharing data and the challenges that exist. What happened with COVID is that the European Commission asked to fast track a working group aimed at developing a system for data sharing in public health emergencies, specifically COVID-19. So typically within RDA, working groups are typically formed within the members who bring together issues and challenges that they want to solve. This was a unique experience in that the European Commission said, we'd like for you to focus on this if that fits into with what you do. And we said, yes, it does. And I'll talk a little bit more about who came together for that in just a second. But I want to point out that there is a difference between the recommendations and the guidelines so that are coming out of this working group. So detailed guidelines have been developed, and they're really aimed at helping researchers and data stewards. While there have also been recommendations that have come out to really help policymakers and funders. So slightly different audiences to still talk about the importance of research data and data sharing within the COVID-19 pandemic. This has been a fantastic community effort. Over 600 RDA members and newcomers registered for different groups. And as typical, a lot of people participate, maybe read about it, but 165 active contributors were present to really help with the documents. And then there have been a select few who've really helped with the writing. So we want to thank everyone on that. There have been experts from different fields, and we can't thank them enough, because if they are experts in a field that has to do with research data and COVID, you know that they also had other obligations simultaneously and would get up sometimes very early to meet calls so that they could get together and build these recommendations to share. So the groups were organized within the RDA COVID-19 group around 4 research areas: clinical, the omics, epidemiology, and the social scientists. And there were also 4 cross-cutting areas about the community participation for data sharing, indigenous data under COVID-19, and indigenous peoples. But Stephanie, you can clarify some of that in a minute. Under COVID-19, legal and ethical considerations for COVID-19, and research software. And we'll be hearing from different panelists to talk about different aspects of these on this call. So is this everything that could have been dealt with within COVID-19 and research data? No, but as anyone knows, when you're running a project, especially under a timeline, you need to scope it. And these rose up as the most important research areas and cross-cutting areas to speak about. You will have access to the slides and the recording, so I'm not going to read out every one of these, but these are the overarching challenges that existed that came up within the working groups, that we need to have rapid sharing of research efforts, findings, and data, that timeliness is balanced with precision, that we have issues with ad hoc research software and the like. We also came out with overarching recommendations, such as that we need to have infrastructure investment and economies of scale to facilitate this important concept of sharing data in a rapid environment, that outputs should be fair and timely, there should be ethical and legal considerations and legal frameworks. Obviously, we came out with more recommendations, and we hope that at least you will read the executive summary and then maybe delve into the pieces that really hit home and are salient for you. Here's more on cross-cutting theme highlights. I'm not going to read over these, but I wanted to make sure, or excuse me, I shouldn't say but Mary and Yolanda really wanted to make sure these were available for you to read offline and for those who couldn't come to the talk today. Here's some more from the other themes of community, Indigenous data guidelines, legal and ethical considerations, and research software. So without further ado, let us start with our first presenter, which is Dr. Stephanie Rousseau-Carroll. She is the chair of the International Indigenous Data Sovereignty Interest Group. She is also the associate director for Native Nations Institute at the University of Arizona. And if I don't mind me highlighting, Stephanie, that you're also an editor on a new book coming out on Indigenous data sovereignty and policy, which I think is an incredible contribution to the scientific community. So thank you for being here, and thank you so much for being on the panel.
Thank you, Leslie, and thank you for highlighting the book. We've already talked last night about how working on these COVID guidelines has really moved forward the thinking that we had in the book itself. So it is timely. So next slide, please. We had 9 members spread across Canada, Australia, New Zealand, Mexico, and Latin America, as well as the US and Southeast Asia. Some of us were already existing RDA members, and then we had some new members spanning disciplines from social sciences to epidemiology to sciences and omics within our group. So I'd like to thank my fellow contributors for their work on this. And really, we wanted to add on to what the other groups were already doing, because Indigenous data, of course, is experiencing all of the other issues that are inherent in COVID and data sharing and times of crisis as well. And so we grounded our work and reflected and supported Indigenous data sovereignty through the document that we came up with, and which is really underpinned by the UN Declaration on the Rights of Indigenous Peoples. Our overall framing utilized the CARE principles for Indigenous data governance, which came out of our interest group here at RDA, that set forth critical considerations for Indigenous rights and interests in data. And we have, with agreement with RDA, published our specific chapter on our Global Indigenous Data Alliance. GIDA is an organizational member of RDA. I'm the chair of GIDA as well, and so we've co-published them with the same DOI on our GIDA platform, and we also have them available in Spanish now. We're in the process of creating briefs of the Indigenous data guidelines, and we'll have that in up to probably 8 languages. So we'll have them in English, Spanish, French, some Asian languages, and probably some Indigenous languages as well. And then we have a scholarly manuscript in production. Next slide, please. So daily reports and global COVID trackers have been used to quantify size, spread, and distribution of COVID-19 and make visible the necessity and power of data during the pandemic. And both the availability and suppression of COVID-19 data raises concerns about data harms. In many contexts, Indigenous peoples, along with other marginalized, racialized communities, are disproportionately affected by COVID-19, directly through infection or fatality, and indirectly through economic and social challenges. More than ever, governments, institutions, corporations, healthcare systems, and individuals require this the data for decision making and for future pandemic planning, mitigation, surveillance. Indigenous peoples and nations likewise need these data for decision making, and these data include metrics that are created by geographic jurisdiction for indigenous people. So within the US context, we think about reservation boundaries, but also for community members who might live somewhere else, as well as robust data that include indigenous status and indigenous nation affiliation within nation and state and local data systems. So in the context of COVID-19, we're talking about data that we think of broadly as health-related data at the individual, but at the community level as well, that tribes might be interested in. So for instance, wastewater testing, as well as indigenous knowledges about COVID-19, and then the socioeconomic and environmental correlates. So these provide a lens, and this is kind of an important perspective to assess the impact of COVID-19 national, regional, and local emergency response and efforts. So we often think of indigenous peoples as the ones who are receiving funds and then have to meet metrics and guidelines for those grants or what have you. And I think we're even more so seeing indigenous peoples reflecting back and saying, we want to see how you're doing. And so that's becoming more important more than ever. So systemic policies and historic and ongoing marginalization have led to limitations in the quality, quantity, and access and control for indigenous peoples' data in COVID-19. So in the US, tribes are sovereign nations, and we're nations within nations. The federal government recognizes 574 tribes, and there's state recognized and other tribes as well. Those federally recognized tribes are also public health authorities, conveying both roles and responsibilities. And we've seen many challenges and some successes to the status as it relates to data sharing during COVID-19. So for instance, we've seen while we have the need to govern these data, we also have the need for data for governance, and the challenges really have been put forth in that arena. So for decision making, we have instances of no data, so where racial and ethnic identifiers or tribal identifiers are not collected in the data. That was pervasive early on in the pandemic here when there was no racial or ethnic identifiers being collected or reported, and we still have major issues around that in certain spheres. We've had limited and controlled access to data as well, where there are extractive practices. So many consider indigenous nations' concerns with open data and data sharing to be a limiting factor for data sharing. But what we've seen are political, racist, and anti-sovereignty stances that limit bidirectional sharing of data with other governments for tribes. So for instance, some states refuse to share COVID-19 data with tribes, even though tribes are public health authorities, and are trying to really be active in that arena. And so states like Massachusetts have been very strongly against data sharing. And at issue 2 is, in addition to tribal data, our data for indigenous peoples in urban areas or living off tribal lands. Here the issue is that almost 70% of people live off of tribal lands for indigenous peoples, and we have urban epicenters, epidemiology centers, and other places who process and work with data. Many of them are staffed by indigenous peoples, and the CDC has been unwilling to grant them those data. Those epicenters have also been recognized by the federal government as public health authorities. And so the CDC has been very difficult to deal with in terms of getting that data so that we can have the ability to utilize it towards the health and well-being of urban natives. Another clear-cut challenge is misclassification. So we can have misclassification of individuals, but we also see misclassification within for tribes, where they might be lumped into the American Indian Alaska Native zone. And this happens because there are no data sharing agreements or relationships to guide the disaggregation to meaningful levels for tribal decision making. And so in my own state, the state has not released zip code data for tribes in Arizona. And they do that to protect tribal sovereignty, but they haven't yet gotten to a place where there's these meaningful bidirectional relationships over those data so that tribes can be assessing, all tribes can be assessing it and utilizing it for their own use. And the other way that misclassification happens is when American Indians, Alaska Natives, when we do appear at that level of racial ethnic identity in data sets, we're aggregated to an other category so that we never appear on the bar chart or anything like that. And so even though we are experiencing in some Native communities such high rates of COVID-19 infections. So finally, we've seen instances of ethics and weaponization of data. So individuals and institutions who are utilizing data in harmful ways, and one of these is still in dispute, is whether or not a New Mexico hospital used data for racial profiling of Pueblo mothers to prioritize COVID-19 testing and then to separate moms and babies once those babies were born. And so you see how we really come to a point where we recognize these cases and numbers are actual people. And then finally, I just wanted to put in a note about participation in large research projects and how in the conversations I've been in, we see this reversion to form where we don't have all of these data sharing agreements, which is a large part of COVID-19 in general. But with tribes, it becomes even more important because there's a legacy of untrustworthy research and policy decisions. And so research projects moving forward, like All of Us and vaccine projects and RADx, and even local level projects are coming face to face with the need that they've never built up those trustworthy relationships to be able to do this research. And we have researchers on the ground who are Indigenous or have been working in these communities for a long time, or the communities themselves saying, how does this benefit me as an individual? How will you protect my individual privacy? But how do you benefit my tribe? How will you protect our collective privacy? And how can we assess the relationships with the researchers and the funders through this process? So these limitations point to a need for Indigenous peoples and nations to be engaged in the governance on their own terms across the COVID-19 data life cycles and ecosystems. Next slide. The CARE principles provide a framework for the collection, storage, access, and use of Indigenous peoples' data during the COVID-19 pandemic and beyond. And so some of the early things that we've come up with, these are for the US, but they broadly hold even in places where infections have not been high and community spread hasn't been occurring. We've already seen some of offenses against these. So we need proactive investment in Indigenous community controlled data infrastructures to support community capacity and resilience. One thing that happened was Maori epidemiologists organized early on during the pandemic and came up with plans and strategies and really never gained footing with the federal government, who just looked aside from them. And their reason for doing that was they knew that people were going to be at risk. And they were obviously taken care of by the governmental response there, but the need to have them at the table in case things happen, especially because they have seen economic repercussions, is important. And then obviously data access and sharing protocols between Indigenous peoples and other governments and data holders, and collection of Indigenous ethnic status or tribal affiliation, and then training and capacity building to involve more Indigenous people in order to enhance data governance and improve the flow of information for effective public health response.
Wow. Thank you, Stephanie, for that wonderful overview. If I may just chime in with one question. First of all, there is an audience member who just said thanks. So I'm sure there are, out of the other 48 attendees, they're also very thankful. So when I was listening to you speak, though, I have to say that some of these challenges seem like they have been there, and COVID-19 just brought them to the surface. And I know from previous work that you've been doing, I've heard you talk about data access, and I hadn't, and data suppression or misclassification and that type. Would you say that's true, or is there also something that this pandemic really has brought to the surface that really wasn't there before, of these very important items?
I definitely think that it's exacerbated what was already there, as is true. But I do think what we are seeing is this resurgence of the ability of Indigenous peoples to take action on their own behalf. So even while here in the US, tribes have public health authority, what we've seen globally really is much quicker response to do things like shutdowns and other types of mitigation efforts within Indigenous communities. And so, for instance, you have some Indigenous communities that were passing mask orders before their state or local communities were doing that as well. And so you see the ability to utilize and the want to utilize that, but the access to the information has definitely shown how much crisis exacerbates existing challenges.
Yeah, which it does. But it sounds like, from what I know from your community and others tribes that I am, see in my sort of Twitter sphere, is that proactive, what you were just talking about, some proactive actions early on, which I, from my biased perspective, I'd have to say that your work and the group's work on research data and having that data available to the community has really helped. So I think that's just fantastic. That's the fantastic part, even if there are many, many things that still need to go forward. And thank you for succinctly putting what we need to do to enhance Indigenous data governance and improve the flow of information. And as I understand it, or as I've also seen, for those who want more information, this is well articulated in the longer form of the RDA document. So please go and look at that. And then if I just may shamelessly also plug your Indigenous Data Sovereignty Policy book one more time. So thank you so much for your time and effort on this. It's very important.
Thank you, Leslie.
So moving on from that, we're actually going to move over into the clinical space. And here, representing the RDA, working group, is Dr. Dawei Lin. Dr. Lin is a computational biologist turned data science official, and he is at the National Institute of Allergy, Immunology, and Transplantation within the NIH. He is key in developing data strategies, executing them, and implementing data science-related programs. Dr. Lin co-chairs the RDA WDS Certifications of Digital Repository Interest Group, and he's also a board member of Core Trust Seal, a community-based certification body of trustworthy data repositories. And because you can't hide backgrounds, you also get to see his wonderful Lego collection in the back. So just to show you how dynamic scientists, researchers are. So, oops, sorry about that. Dr. Lin, thank you for joining us.
Yeah, thanks, Leslie, for the nice introduction. Also, Mary and Yolanda for organizing this workshop. And so the clinical data sharing is not is new. Like, a lot of people have done a lot of work on this. I think what is unique about this effort is how to share clinical data during the pandemic. And I want to talk here on behalf of the working groups with the show on the slide. It was a very, I should say, very productive and very inspiring experience that to see people just contribute your time and make the morning calls and work together. And next slide, please. So before our group started working in April, and we have this SWOT analysis, which is like what is the strength of and what is of the group, and what's the weaknesses, opportunities, and threats. And I reflect that now I think that those analysis is still valid. And I presented today is that because it may give you a background, like how this recommendations and guidelines come into being, and maybe with that background, you will know what how to use those recommendations and guidelines. So in terms of strength, I think Leslie already mentioned about overall strength. I think this is a particular for the clinical group, and there's a lot of different type of expertise and perspectives, and also the people are really committed to contribute. And the opportunity is that we are able to have some cross-cutting, meaning like even cross like the governments and countries and different organizations, and also like different disciplines. Like we'll probably will never talk if among ourselves, with the like social science or other sciences, without the driving force of fighting the pandemic. And the weakness is that we don't all have a day job what we wanted to do, and then it is a volunteer job, and then the threats are that we don't know how long we will last to working together, and then if we have a conflict, what is the way to resolve that is uncertain. Next slide. So the things what I highlight in blue color are what actually happened during the couple of months. Like for example, the strength that we do see that from the contributions of clinicians, policymakers, data researchers, and some people are the actual standard developers, and the people are like to work and to put the group together. So that's the strength, definitely, I think is out there. And the weaknesses is that the weekly calls we have is pretty early in the morning for the U.S. People to participate. It's like 7 o'clock in the East Coast. It's hard for even like the West Coast to do. So mainly the participants are from European. I should say. I think maybe that is one of the reasons. But I think the quality is not. I feel is not compromised. I think there's a lot of people have they presented work that have published for a long time, and then is more like adapted to the pandemic situations. And the opportunities is that there was the cross-cutting recommendations are like the recommended using trustworthy data repositories, and probably you heard a lot of trustworthy within the other recommendations from other groups, but that's kind of like particularly important for the clinical group. And also early on, people point out like there is no imaging data recommendations, there's no immunologies, and ask around the community, and it was a lot of recommendations.
Dawei, do we still have you there?
Actually, I still have me here, and somehow my computer screen is done, but maybe I can talk.
We can still hear you just fine. Yep.
Oh, okay. So that's and then the threat, I think that is that we I think right now, I think the after group finished, and I think the activity is low, and although we're still thinking about how to like continue this work, I think I should say that there's those recommendations and guidelines is more like people come together and have some input, but it's still, I think, is ongoing work. So next slide, please. So Leslie, since I cannot see the screen, could you let me know what is the title of the slide?
Yeah, this is the challenges about time pressures, weaknesses, and methodology, and then the recommendation. Okay. Yep. Thanks.
Yeah, I think so. So I think, as I said, that we want to focus on the specific challenge for the clinical data, and then for the pandemic, I think it is that there's time dimension put into it, and so we want to balance this release data fast, but also we wanted that once you release the data, it is useful for people to make decisions. And then another point I'm trying to make is on the the up right corner, there is two categories. One is recommendations, is more general for like policymakers, founders, and then the other is the guidelines, like which is the detailed guidelines for people who want to implement something. And then that's, I think, we're trying to learn the lesson from the previous pandemic data sharing. For example, that there was a lot of statements made for the Zika pandemic. So the COVID is not the first one, but there's a lot of actions is not follow up with the recommendations. And I think that especially for our clinical group, we're thinking about maybe put out some guidelines and for people not only know what the big pictures are, but also there's a details steps can follow to help data sharing. And then there is 4 sections. I think I would like to refer you to the documents to do this, but I put the icon there, like, the first sections about the trustworthy source of the data is a recommendation, and then the other 3 sections are the guidelines. And then I specifically want to mention that the imaging and immunology and the healthcare data the guidelines are the ones pretty unique in the whole working group, and we're trying to kind of so there was a lot of other data sharing. Probably Natalie will talk about is Omics, and those are in those sections, and the 3 topics I mentioned are specific to the clinical group. And on the next slide. And I think that one thing we're thinking about how to know what the impact of this recommendation, the guideline. Like, so if nobody use it, it may not be effective. So one thing we want to, I think one example I want to give you today is that is the trustworthiness, and that is have impact of some events, and then especially I think maybe if you can move the last slide. I think a lot of news about this hydroxychloroquine, and I want to go into the details, but I want to focus on the published reasons. And the first block of the slide, you can see that the reason is because some authors could not access data, so they cannot audit data. Essentially, they lost the trust of the data, although they may do like very sophisticated analysis, but without the trust of the data, and the outcome cannot be valid. And so I think that the second box I want to point out is that even though they retract paper, but some damage has been done. There's a lot of clinical trial has been interrupted, and then some policies made for those based on those research results. So that I think one case is that that maybe we should look back to the recommendations that we did mention that, like even during the pandemic, and we want people leverage the trustworthy data sources, including the data repositories, and that is sometimes you think is slow, but it may not be the slow as you think about it. So I think that's all I want to mention in my presentation.
Thank you so much for your presentation. And thank you so much for your time, because I know in particular this group, I know a little bit more than the others, but you guys got up very early to talk about this. So do you mind just quickly highlighting, your recommendation for trustworthiness, what could be a one takeaway that people could have that would be a recommendation regarding understanding or working with or identifying trustworthy data?
Yeah, thanks Leslie for the question. I think my last slide, I think I didn't mention that we published the trust principles, and it was in the Nature's Research Scientific Data in May, and that highlight what other key component if you want assess a data resource is trustworthy or not. And basically it's kind of acronym for trust, and then T for transparency, so that you have to be transparent with what you can do and what you cannot do, and then provide the evidence public available that people can verify if you're trustworthy or not. And then the R is for responsibility. Basically, you have to do what you promise to do. And then U is for user focus, meaning that the user is your center. Is that whatever they want to do, like either they say they want a fair, you gave them fair. If they want to open, you give them open. And then particularly for clinical data, if they want to be closed, and you make it closed. So you do whatever the user to do. And then the S for sustainability is that you want to do this for long term, and you want the data to be there when people come back to check it out. And then T for technology, and also I think it's pretty relevant to clinical setting, is that you want to protect the cyber security attacks and provide the protection of the integrity of data. And so that's that is the kind of basically the key idea for trust principle. And there is like 27 organizations have already installed it, endorsed the principles at the RDA website. And then I recommend it probably if you want to read the paper and then to understand more, what are the ways to help you to assess the trustworthiness of the resources.
Leslie, you might still be mute.
Yeah, I appreciate that. I was just saying that if you want to, I was thinking, Dawei, thank you so much. And I was going to say, if you want other information, please email us if you're not getting the answers now. I know we have a couple more questions for clinical, but I want to move on, and I'm going to save those for later. So thank you so much again, Dawei Lin. And now we are going to move over to Omics, and where we have Natalie Myers as the interim director of the Navari Family Center for Digital Scholarship in the Hesburgh Libraries at the University of Notre Dame. And I think one of the exciting parts about having Natalie here is you also, whether you want to or not, you represent the libraries, and which is a critical component when we're talking about research data. So thank you for being here. Thank you for participating in this, and we look forward to your talk. And you froze for a second.
How about now? Any better?
Yep, there we go.
How's that? Terrific. It's a pleasure to be here, and a pleasure to follow Dawei and to have the on-ramp that the trust principles afford us. I'd like to introduce you to the Omics guidelines, which were drafted in synchronous meetings and asynchronous work periods, co-moderated by Rob Hooft and myself. You see a picture of Rob here on the screen. This was not a one-man band. We started in mid-April, and if you could show the next slide, Leslie. We worked together on guidelines for virus genomics data, host genomics data, structural data. There will be an example coming soon, metabolomics and lipidomics, with experts from each group. Among the members you see here on the screen, there were about 80 of us overall. working together to draft each of those guidelines according to our expertise. Next slide. And the understanding of the ways in which the SARS-CoV-2 virus causes the COVID-19 disease is based on research into the molecular biology of the processes at the cellular and subcellular level. Those really are the kind of research that are the focus of the Omics section of the RDA guidelines for data and software sharing. And the data of this style, the data of molecular biology that surrounds those processes at the cellular and subcellular level that most concretely describes the focus and description of our work. For the scope of our work, it was pretty broad. We defined omics as data from cell and molecular biology. And for most of the data modalities, we recognized that that data can be deposited in existing database resources. Many of those resources now support COVID-specific 19 subsets. And within the scope, our recommendations on data that are already frequently associated with biological research on SARS-CoV-2 and COVID-19 are prioritized. So I hope that gives you a little bit of an introduction into the content of our part of the recommendations. Next slide, Leslie. The Omics policy recommendations are really concentrated on the researchers producing the data and informed by our group, the volunteers, those 80 people you saw on the slide earlier, those members of our volunteer group, and our awareness of the FAIR data principles for the prioritization of findability, accessibility, interoperability, and reusability of data. We all shared the primary concern that the availability and reusability of research data on COVID-19 was necessary in order to prevent the unnecessary duplication of researchers' work. So we concentrated on 3 primary considerations for omics during the pandemic. In no particular order of importance, but I will emphasize each one. Our recommendations are concentrated on reusability of data and how that requires documented provenance. The importance to increase the reusability of data with consistent pre-processing, and the importance of emphasizing the message to researchers. And if there are researchers on today's call, and this is you, this is a time that I hope that our guidelines are reaching you. If you have any existing SARS-CoV data, MERS-CoV data, or EBOV data that have not yet been made public, we beg you to consider publishing that data now, as it can be a very useful research reference to those working on COVID-19. To policies makers and funders, what we recognize is that due to the high costs involved with high throughput genomics, we recognize that few data are available from low and middle income countries, and sometimes from ethnic population in high income countries. This can lead to improper extrapolation of results for under and unrepresented population groups. And we hope that if there are policymakers and funders on the call, that research which can improve that coverage should be worth preferential treatment for funding. That's a primary concern of our group as well. If we could see the next slide, I'll show you from a sort of 30,000 foot view level how our omics guidelines are structured through an example looking at the lipidomics section of the RDA COVID-19 working groups take on data sharing for lipidomics. Each of our sections in omics follows a similar structure. where we offer generic recommendations for researchers, which lead them to best practices for data sharing guidelines for the discipline overall. You can see an example of that here on the slide in 4.4.6.1. Then we move on to talk about the recommended repositories for the discipline and its data types. And from that, we move on to talk about data and metadata standards. You might be asking yourselves, why lipidomics? Let me help you bring context to some of the ways that Omic researchers encounter COVID-19 in the lab. In COVID-19 patients with pre-existing conditions, lipidomics research can reveal an altered lipid composition in infected cells and serum lipid levels. Lipid rafts or lipid microdomains can play a critical role in viral infections, facilitating virus entry, replication, assembly, and budding. The lipid rafts are enriched in glycosphingolipids, sphingomyelin, and cholesterol. It's likely that the SARS-CoV-2 virus enters the cell via angiotensin converting enzyme 2 or ACE2, and that depends on the integrity of lipid rafts in the infected cell membrane. So the way that we study and share our lipidomics data is of primary importance to finding ways to combat the disease. If we move on to the next slide, we can see another example for how we recommend data sharing for structural omics data. Here I'll take you first through the section of the Omics guidelines that deals with repositories. We talked and heard earlier from Dawe about the importance of trust and knowing which repositories were appropriate for which kinds of data. For structural omics data, we recommended and promoted attention to WWPDB, EBI, PDBE, and EMDB for protein structures. Those databases, EMDB for Europe, RCSB PDB for the United States, and PDBJ for Japan, together that data is shared upward to all participants in the worldwide protein data bank. If we look next at, if you'd move forward to the next slide, Leslie, we can look at how researchers, you'll see highlighted in green, how structural omics researchers can find existing data to help them delve into the COVID-19 research they're pursuing. Here we recommend looking in the COVID-19 Molecular Structure and Therapeutics Hub by Mulsey and BioExcel. And then if you move down into the light blue, you can see how for structural data, we recommend that researchers can get the appropriate data and metadata standards that they need for each of the following types of research and its data. For X-ray diffraction, for example, there are no widely accepted X-ray diffraction data files. Generally, those are stored and archived in the vendor's native formats. The metadata might be stored in CBF or CIF format. And we've provided examples in the guidelines for researchers to access the catalog of metadata resources for crystallographic applications in order to understand that diffraction data and its metadata components. Furthermore, for X-ray data, the processed and structural information can be submitted to structural databases in the PDBX MMCIF format, and we provide examples in the guidelines to a paper by Fitzgerald on how that processed structural information can most easily be shared. Similarly, for electron microscopy, for NMR spectroscopy, for neutron scattering, for molecular dynamics simulations, and for computer-aided drug design data, we have specific recommendations for each that guides researchers on COVID-19 through finding the best repository to deposit their data, the best ways to locate existing data, and the best ways to share their data and metadata using standards that are appropriate for all researchers. So really appreciate your attention to the Omics component of the RDA guidelines. And if you need further information regarding NMR, neutron scattering, molecular dynamics or MD simulations, or computer-aided drug design data, I encourage you to consult the guidelines or any of the members of the Omics volunteer group. Thanks so much for your attention and for your participation today. Thanks, Leslie.
Thank you, Natalie. Thanks for bringing the Omics perspective in here. And it really shows us where we go from a population based from indigenous peoples to clinical to a much more granular Omics. And thank you for the example, because I was not aware of the different aspects of the importance of certain things that we're finding within COVID-19. So one of my questions within these fields, and I know within Omics, and I know Omics is broad, whether it's genomics or metabolomics or lipidomics, with the data sharing, we have the balance between privacy and accessibility and the need for accessibility. Was there anything that you guys noticed, maybe a low-hanging fruit that could help make data, some of these very crucial data to help making decisions more available more quickly? Is it the repositories? Is it, and it's, because you certainly focused on that. Is there something else in addition to that?
Part of it is interoperability between repositories, labs, and vendor systems.
Okay.
And another big part of it is making sure that when you submit a paper for review or findings in a presentation, that you make the data backing that up available to others in repositories that are close to the analysis tools that they need in order to confirm your result or do their own analysis on top of it. Omics data alone typically requires analysis software for its interpretation. And we worked closely with and had many members in our group who also participated in the RDA COVID-19 recommendations for software sharing. So all the way from analysis to data sharing to reuse is, think of it as a continuum of both peer review and reusability that enables us to look at the data and the way that it can present itself with greater veracity, but also in such a way that it accelerates research because it's more easily shared.
Nice. Thank you for bringing in the software. And it's one of those things, I'm not sure who all in the audience is here, but those of us within the field, this really has just brought to light that not just interoperability, which you mentioned is so important, but that ecosystem that we live in between the science and the software and the data. So keeping the data and the analytics software close is a take-home message, definitely, for everyone. Natalie, thank you again for participating, and we'll have more questions at the end.
Thank you, Leslie.
And now we're going to talk about community participation. And with that, we have Dr. Daniel Meachin, who was the RDA COVID-19 Community Participation Group moderator. He's a data scientist at the School of Data Science at the University of Virginia and has been a longtime active member in RDA. So thank you, Daniel, for being here.
Okay, thanks. Next slide, please. Yes. So for us, it was important that we started out as one of the 5 original subgroups, but we were kind of an odd one in there. So the others had a clear thematic focus, whereas our focus was on community. And so we spent the initial time actually just trying to figure out what the best way is to bring community perspectives into this document. And in the process, we ended up actually being restructured such that community participation was recognized as a cross-cutting theme, along with the research software, the indigenous data guidelines, and the legal and ethical considerations. And while some of the other groups were already like busy like drafting their concrete texts, we were still organizing ourselves. Next slide. What happened then is we had community participation. Oh yeah, I probably should mention, yes, we do have, like any of the working groups, we have a site and also the moderators. This was not a single moderator, it was a team. If you click on the names there, you actually get to their profiles. And Joanne is on the call. So it was a team and we had diverse backgrounds, whereas the other working groups, they all more or less had some sort of a disciplinary coherence. We were scattered across disciplines, and so we brought in all the different perspectives, and then we had 120 people in the working group, and we tried to channel all that energy and thoughts through regular group calls and actual writing sprints, and we made a survey to identify use cases to address. And then we rinse and repeated. Next slide, please. So one of the things that we tried to keep in mind here is the aspects of data sharing within and across communities. And here initially we focused, like the entire document, on research communities. So we considered aspects of data sharing within the communities that are targeted by the thematic subgroups. So we looked at Omics, clinical, social, and epidemiology, and tried to contribute there and bring in a community perspective to that. So for instance, in the clinical working group, we added more or less a patient perspective. And then we also zoomed out. So what does data sharing mean across communities? And there we had, again, several layers. One layer was those emerging cross-cutting themes like the software and indigenous data, but also like how can we share data between omics and social sciences, or between different domains in general, or between researchers and politicians. And with that last example, that's actually one of the things that speaks to community participation in a wider context. So COVID-19, since it's a pandemic and affects like most people on the planet, this is unusual in research contexts. Even research that is addressing fundamental problems of humanity does not normally have direct connections to like most of humanity. And so here we tried to think about mechanisms by which communities outside research already interact with the research community, and to what extent data sharing can and does play a role, or even the lack of data sharing, as was alluded to in the indigenous presentation at the beginning. Our document then, or our chapter, actually contains a definition of different stakeholders that are relevant, most of which are not researchers, and includes policymakers. It also includes citizen scientists, which of course are researchers in a way, but they didn't pop up specifically in the other contexts. And so we named them specifically because this community response to the pandemic has lots of aspects of citizen science, lots of overlap. And then we considered a number of use cases, especially community-generated data via so-called Corona apps or COVID apps. And so what are the implications of having such an app? Then what should the developers keep in mind when designing the app? what should the data generators, that is the citizens that are actually using the app, what should they keep in mind, or what kind of input can they provide beyond just delivering their data? How can their data be protected? These kind of things. So that was one use case. And then other use cases were like, how can data facilitate community participation in disaster response? Yeah, and then like the other chapters, we boiled this down into recommendations to policymakers and some guidelines for researchers and teams around the data collection and data stewardship. Next slide. Yeah, and here, this is like the essence of it. So for instance, citizen scientists, they're not really trained, or not necessarily trained in aspects of ethical data sharing or technical aspects of data sharing. And so we thought about how this could be achieved. We do not provide specific language as to how to do it yet, because just the array of possibilities for citizen science to occur in the COVID-19 context is just too vast. But we want to make sure that this is not forgotten. Then we want to encourage public involvement and also patient involvement throughout the data management lifecycle. If you consider classical citizen science, it usually is such that some, let's say, researchers, they open up some aspect of the research cycle, and thus also some aspect of the data management lifecycle, and they say, here you can participate. But the holistic addressing of the pandemic requires that the data management cycle as a whole is open to public participation, and participation by patients and their relatives and such. And so we consider the implications of that. And in doing so, we also consider the balance between like timely testing of the individual or of groups, and then balancing the like whether to keep the individual results private, and how to aggregate things like that, and how to get community input. And next slide, please. Yeah, so lots of, whereas many of the other chapters, they're essentially done already, and they will require, let's say, minor updates in the next rounds of this document. We actually think the community participation document is not done at all, because there are lots of aspects where we still learn new things as the pandemic unfolds. And this is both challenges and opportunities for getting community participation right, or learning from where it got wrong, or where it was actually prevented by certain circumstances. And so we would like to invite everyone to get involved. The address was given, and I'm happy to take any questions.
Great. Thank you so much, Daniel, for that great overview. And thank you again for participating in the community participation subgroup. So we do have a couple of questions for you. The first one is, what are the main challenges for data sharing within and across research communities that you see?
Yeah, so within, let me split that into the two. So within and across research communities. So within communities, the main challenges are like basically how to define standards, and then if there are standards, then which ones to choose, and who makes the decisions, and things like that. And many of those decisions, they are the thing here is we do have more or less established mechanisms to make such decisions within a certain discipline or domain. And then those might not be optimal or so, but at least there is something. You have conferences to go to, you have scientific societies, you might have journal policies, and you have funding sections and things like that. All of these have certain mechanisms to kind of help structure the sharing. If we And then there are challenges still because the standards continuously evolve, and there are new technical, legal, and other frameworks and to be considered. But yeah, let's put that for the within discipline sharing. Now let's take a look at sharing things across discipline. And here the problem is, first, we don't have any established mechanisms of communication. Then also language might be completely different. Like certain terms that have a certain meaning in discipline A, they might have a completely different meaning in discipline B. And so even if you have a nice table that gives all in the section headings all sorts of metadata about what was being acquired, someone reading this with a background in a different discipline might interpret the data in a different fashion. Then the tools are not shared. And then lots of things in terms of, let's say, large-scale sharing, they involve licenses. If you are sharing data or tools within a close-knit community, there are often informal ways of getting your hands on the data or on the tools. You just send an email to the PI or something that you've met at the conference. But if you're doing this across disciplines, you often are not even aware that those resources even exist. Or if you think that they might exist, you have no easy mechanisms to actually find them. And if you might have found them, maybe they don't tell you much because they're like wrapped in a language or in some tooling or in some metadata that doesn't speak to you. And so these are big challenges, and the pandemic has exposed them. And that's the kind of challenges that RDA tends to address. Many of them are still open. And then if you look at the landscape of working groups and interest groups and other substructures within RDA, they try to address some of those aspects. But it is clear that we do not have consistent mechanisms to share data or even simpler things like simple communications across communities. And sometimes also for just the drafting of this document, it often boils down to like which tool do we use to write things, which tool do we use to keep track of the references and all of that. And within a disciplinary community, it's easier to reach consensus on that than if you have people involved from multiple disciplines.
Yeah, thank you for the that perspective. It always makes me think about what you were talking about, the word significant, because statistically significant doesn't mean that it's important. So that's an example of just a simple word that has different meanings depending on which group or community you're in. So lots of work still to be done, as you say in your slide. I think we have another question. I'm going to save it, and I think we can also follow up with the audience members if there's other questions. So thank you, Daniel. Thanks again for your time, and really appreciate your perspective.
Thanks.
Now on to our last panelist. We have Dr. Amy Pienta, who was the RDA COVID-19 Social Sciences Group moderator. She is a research scientist and the director at the Business and Collection Development within the University of Michigan. And I forgot to ask, there's always a way to pronounce the acronym, so I'm going to let you do the ICPSR, because I know there's a way to say it and I'll say it wrong. But Amy, thanks for your time in working on the COVID-19. As mentioned before, it takes time out of your busy days to do this. And so why was this important? And what did you find out about the social sciences? I should have saved my question for last. I got excited. So we'll let you take over from here.
Thank you, Leslie. And you can move to the next slide. So yes, I'm Director of Business and Collection Development at ICPSR, which is a social science data archive in the US housed at the University of Michigan. So I did want to start just really quickly to acknowledge two people who helped tremendously with the leadership of the social sciences group. One is Ingrid Dillow from DONS. She was our liaison to the overarching co-chair group for the COVID-19 working group. And my co-moderator, Irina Kuchma from EIFL. So Arena and I had lots of early meetings with our group, and you can see that group on the next slide, if you will, Leslie. We had another really well-attended membership group from the social sciences, like you saw from many of the other groups, 85 members, with 20 members who are really very, very active, and we had our meetings early as well at 7 a.m. We had a couple of North American and South American participants from the US, from Brazil, and from Canada that were very active. And then two other places that are very heavily represented in our the development of our guidelines, of course, is Europe, where we had many active members and authors of our guidelines, and South Africa. So across that group, we really hit hard and took to heart the instructions that we received on writing guidelines and recommendations around the structure that we were provided. It's kind of funny. We were kind of the rule follower group of all the subgroups. We wrote extensively and in an agile method, meeting twice a week from the inception until the timeline that the guidelines were first due, and then redrafted, still continuing to meet twice a week, and really produced a lot of text. So much that in the first draft, I think we had double the amount of words that we have in the final guidelines. And in the first draft, we had addressed all of the areas. So it was kind of funny. Again, we were the rule follower group. One of the good things that happened, though, was that at some point, the legal and ethical guidelines that were developed became a spin-off group and a cross-cutting group. And so fortunately, one of our very heavy participants and authors of that part of the section for the social sciences spun off, a couple of them actually spun off to lead the legal and ethical cross-cutting group. So they took a lot of text with them. And so we finally got our text down to a manageable amount. So with that, I'm going to spend the rest of my time, you can go ahead to the next slide, giving a few highlights once I provide this motivation, because this was really the heart and core of, I think, every discussion that we had as we met twice a week for many, many weeks, which was social sciences was really happy that it was recognized from the get-go as being an important set of disciplines. Really, it's not one discipline, but lots of disciplines that make up the social sciences that were recognized as being important to accelerating data sharing so that we could realize the full potential of data in helping us address challenges of the COVID-19 pandemic. And really, what we talked about loud and clear in all of our meetings is that we were really wanting to be part of encouraging scientific discourse that moved beyond just simply studies where demographics were sort of the additional set of variables, but also to include other things that are important in addressing the challenges of the pandemic, including social, economic, and political dimensions of what is going on. And you can see here a list of things that, because we're not just scientists here on this webinar, but we're also humans who have these complex social lives and really understand firsthand that the pandemic is so much more than the medical and clinical impacts, but rather affecting how our lives are organized, whether it comes from organized within our homes to changes in the work domain, to changes in our physical and social spaces where we enter certain doors and walk in certain lines. All of those things have been transformed and important to the discussion. So you can move to the next slide where I'll share, and this one will be quick. A lot of the recommendations or guidelines that we have made really are around facilitating data linkage. And that's a topic that is both important to social scientists so that we can do the work that we do for ourselves, but also so that social science data can be linked to the data of other domains. Next slide, please. And so while it is common practice in the social sciences to store data without direct identifiers and to replace personal identifiers with randomly assigned IDs, for example, one of the recommendations that we've made is that where possible, researchers and data collectors should seek legal authority to be able to retain the identifiers, at least in a separate file, well, of course, in a separate file and under secure conditions, in order to facilitate potential data linkages down the road, perhaps things that the researcher hasn't even envisioned at the get-go. Next slide, please. Another way to facilitate data linkage is by that we talked a lot about is by encouraging the use of standardized codes for the places where people live. So whether that's statistical agencies producing data or researchers, we encourage the use of standards such as the ISO standards or FIPS for US states and counties, and other kinds of standard identifiers for organizational entities like companies in order to not only facilitate data linkage, but also for better data analysis, for data harmonization, visualization, and integration into apps. Next slide. Another one of our goals that probably you will not be surprised is that social scientists think a lot about generalizability. A lot of our studies are done at really large scales, either national or regionally. And so the social sciences has both simple to complex methods for dealing with generalizability when samples are more localized, which is very true of the COVID-19 pandemic, where we can't always ask the nation to answer our surveys in a quick timeline. So because of a lot of the studies are small scale and local in the social sciences and elsewhere, we made recommendations about making sure to collect the variables for those small samples that may not be representative that could be used to compare against national samples. So variables such as demographic characteristics and geographic variables, things about testing conditions, all of those things allow for better comparability of that small sample with the population where you're trying to make an inference to. Next slide. And then I think this is my last one. We also, like Dawe, talked a lot about ensuring that the data that are being produced end up in places that are trusted repositories. And so that was very important. But we did spend a lot of time thinking about, at least in the social sciences, where there are lots of options for where data can be stored, that as a first choice, we were encouraging data sharing in disciplinary repositories where they exist in order to get maximum visibility for that data, to ensure that the data are curated and made available in ways that do it justice. And then where that's not possible, we also recognize the importance of both general repositories and institutional repositories as being homes to data that could meet similar goals. Is that my last slide, Leslie?
I think
yes,
so.
It was. Okay, that's what I thought. Thank you.
So thank you for that perspective. Oh, I need to turn on my video. Here we go. Thank you so much, Amy. You bring up a couple of good points from the social sciences. So not only I think are you bringing up that there's different data to think about that, and I wasn't sure if you talked about that in the context or actually talked about that in the collecting some of those other data within the social sciences, the data of childcare, of working from home, of what to be a small business owner, and how, because that affects other aspects of health, if you will, even though there's more to COVID than than the clinical health, I guess is what we could say. Could you just clarify kind of what you honed in on that? Was it both what you should be thinking about and how to collect it, or did that just come up as part of the conversation and not
Right.
in your long document? Yeah.
Definitely. So certainly we were thinking about both things. So one, that social scientists collecting data should think about the things that they can do to organize and collect and make the data maximally useful to other disciplines. But then there was also an element to our recommendations that were about encouraging multidisciplinary research in general, such that where possible, that we are tackling and studying problems from multiple disciplines where the social sciences are represented alongside other issues. And so if you were a clinician collecting data, encouraging multidisciplinary teams to aid in collecting additional kinds of social science variables at the same time would be helpful to provide that additional context about the individual, the household they live in, the community they live in, and the general macro context around who they are and what's important when you want to treat them effectively, when you want them to seek appropriate care, and so on.
Thank you. So very, very important to the overall understanding of COVID-19, very important to understand in science. I think like any other thing, what this pandemic has done has brought to light the things that we needed to pay attention and to bring to the surface within science, within social sciences in our case. So thank you very much. Given that we have a few minutes left, I'd like, if we could, to have all of the speakers back on. I hope it doesn't stress out the GoToWebinar too much. But while they're doing that, I do want to make sure that you know that there are COVID-19 resources that are available from RDA. You can find them on the links. And let me see, Mary gave me a note that they should be on our RDA channel and the presentation on the value of RDA for COVID-19 site, which is are linked right here. So given that we only have a few minutes left, what I wanted to do was kind of start over from the beginning. So that puts you on the spot a little bit, Stephanie, sorry about that. But really, what is the take home, that the one thing that you want people to walk away and remember, or resource that you want for them to go to? What is it that you want the audience to walk away from what the work you've done? So Stephanie, I will start with you. Dawe, you know you'll be next.
I would say leading into recommend that everybody, if they've not made themselves familiar with the CARE principles for Indigenous data governance, to do that. I'll put it in the chat, but it's gita-global.org/care. And also to think through in your work how to better engage and also set up actual mechanisms for documenting and moving forward with Indigenous rights and interest in COVID data.
Thank you. And real quick, can you just say what the letters stand for in CARE?
Yes, they stand for collective benefit, authority to control, responsibility, and ethics.
Perfect. Thank you, Stephanie. Dawe, what would you like for people to walk away with today?
Yeah, I think besides the trust principles, I really want people to look into the guidelines that we put into the documentation, and it is the imaging data guideline, immunology, and then the healthcare, and that's the unique ones, I think, is all of the group.
Perfect. Thank you so much. Natalie?
I would say that hopefully you can hear me. I think I crackled. That I used the guidelines today in helping someone prepare their data management plan for a funding proposal. What we have in the guidelines now is something that can, as I think it was Daniel brought to our attention, it can help us prepare for future pandemics, future research projects. We can all improve one another's work by referring to the guidelines for best practices not just for the COVID-19 pandemic, but for any societally challenging research question that might require data sharing or software sharing of this kind. It gives us a touchstone, if you will, for how to help one another and help others.
Perfect. Thank you, Natalie. Daniel?
Yeah, I would basically just like to deepen this point. So this pandemic is not over. The next one is certain to come, and that there are other emergency situations. And humanity has a long history of sharing in disaster contexts. And data is kind of a new kid on the block in this sharing theme after disasters. And now is a good time to actually think this through and make use of the technical and social opportunities that we do have in order to tackle the social and technical and other challenges that we have in these disaster contexts. And so basically my last slide said, it's not over yet, let's get involved and see this as a learning opportunity. Dawei mentioned in his presentation that COVID response has benefited from the experience that we gathered from Zika. Zika response in turn has benefited from the Ebola, and everything. We're standing on the shoulders of both giants and microbes, and that's important. We need to be able to share data at all of those levels between the giants and the microbes, so that we can actually learn from things in the past and be better in the next round.
Beautifully stated. Amy, do you want to add to that?
Yep, I would
Or
just say
something?
that, oh, yep, you can hear me. I would direct people to the Zotero library related to the social sciences section, in part because we had a lot of very rich metadata standards and resources to draw upon in the social sciences. And so our guidelines refer very much to a lot of the very good work and best practices that have been done more globally. And the Zotero reference section is a place to jump off and see all of that work.
Perfect. Thank you so much for summarizing. Thank you for your time. I think if I can just do a chime for the Research Data Alliance, this is what we do. We bring people together to talk about data sharing. You've heard the different challenges, the different opportunities that people find, and that we're working towards solutions on. So thank you for your time and attending. Thank you all for participating in this, and the panelists, the moderators. I'm sure that everyone would be clapping at home as well. And everyone have a great and safe Friday and weekend. Thank you very much.
Thank you, Leslie. Thanks, everyone. Great to see you.